It's been 3 years since the Supreme Court overturned Roe v. Wade. That did remove federal abortion protections.
Nevada has its own abortion protections in state law, but as Ozzie Moore explains, the future of reproductive health care is evolving.
Healthcare providers everywhere are working to redefine the legal frameworks around abortion. Advocates I spoke with explain why out-of-state doctors try their hardest to remain anonymous.
They say one way to do that is to keep their names off of abortion medication prescriptions. One doctor discussing this topic with me over Zoom prefers not to share her identity.
How long have you been an OBGYN now?
I delivered my first baby in 1985.
For years, she has practiced in Nevada. She tells me she supports a recent push of providers wanting anonymity on abortion-related prescription labels. It's a push Republican Governor Joe Lombardo X'd out, vetoing a state assembly bill on the topic in June.
I've introduced Assembly Bill 411, a simple but powerful step towards privacy, dignity, and security for those who provide essential reproductive care.
Democratic Assemblywoman Sandra Jauregui sponsored the bill, but we weren't able to connect for an interview about AB 411. But when the governor nixed it, he said he did it in the name of transparency. Some against the bill calling it absurd and saying those who are ashamed should consider a new profession.
And so removing the provider's name seems like a common sense solution to decrease the risk of violence against a provider.
She says providers shouldn't work in fear, yet she says in her experience, they do.
Many years ago, there was an article in a local paper that had some significant amount of misinformation about fetal development. And in response, I made the decision to write an article.
And after that article, she says she woke up to find her mailbox covered in ketchup.
This is the reality, unfortunately, of people who are providing reproductive care.
And the people who support it, says Denise Lopez. She's the director of Nevada Campaigns for Reproductive Freedom.
We want to make sure that we are providing life-saving care to patients. We are seeing in many other places OBGYNs leaving states.
States without strong abortion care protections, which Nevada has. The Center for Reproductive Rights says people living in restrictive areas have to travel out of state for abortion care, and they're coming into our own backyard. Since April, patients from 8 states outside Nevada and California made their way to Planned Parenthood Center in North Las Vegas. It's where the center says those traveling are able to get abortion drugs.
Despite all the threats and attacks, doctors, for example, are still providing the care. Our communities are still finding resources.
Both the doctor we met at the beginning of this story and Denise Lopez from the advocacy group tell me people from states with abortion bans are turning more and more to telehealth for those hard to get prescriptions. I'm Ozzie Moore, 8 News Now.
5 states, 4 of them with Democratic governors, have all passed laws to remove prescribers' names from abortion prescription labels.